Hi there, my name's Rory. I'm a principal with Elixirr based out of New York. Um, we've been doing a series of videos with leaders from around the world to try and understand some of their perspectives, some of the challenges that they've had and some of the opportunities that they've created in light of the events of COVID-19. Today I'm going to be speaking with Tom Raffio. Tom's the CEO of Northeast Delta Dental. I'm quite excited about this because, as Tom will tell you himself, he's led the company for a very long time and has seen a lot of challenges come and go. So it'd be great to get his perspective. Tom, I'll start by asking you a little bit around how COVID-19 has impacted your business from an internal perspective. What are some of the changes that you've seen happen and need to be made, and how those panned out?
Absolutely. So first, thank you for the opportunity, and it's great working with the Elixirr team. So as you mentioned, I've been leading this company since 1995 for a very long time, and no, there's never been something like this before. We actually did plan for a pandemic. So for example, we had plenty of masks, which now our on-campus employees socially distanced are wearing. We had planned as well for a super duper new phone system, which would allow our customer service call center to take the calls from home. So we actually did a fair amount of planning, but I'd be the first one to say that I never expected a pandemic, such as this one. But we also knew that eventually, because nobody would be going to the dentist, that we would have to do furloughs. So they extended 10 additional days of paid sick time, or what we call emergency relief. So before people had to be furloughed, we gave them another 2 weeks pay, and then we methodically have furloughed very humanistically about 15% of our workforce. Constant communication, authentic communication, not sugarcoating, some human interest, giving them some tips for those that work from home, some of the ways you can work from home in a more improved way. The other thing I think they like is that, I'm very authentic. I say, look, when I'm home, as I think I've mentioned to you, I start my morning doing emails from home. I have an office set up there. Then I come into the office, and so, there are some emails where my granddaughter, who's almost 2, is crawling on my legs, and so I say to our employee colleagues, let's just speak the truth. If you have kids, there are going to be times that you're going to be distracted. Just accept that. And there'll be some days that maybe you only worked at 60% efficiency, but other days you probably work 15 hours. So I just try to be real with our employee colleagues and try to stay connected virtually. And then again, there's a small number of employees that I get to see every day anyway.
Yeah, it'd be interesting to talk more about some of those external facing initiatives that I know you are very quick to make to try and get ahead of this. So it'd be interesting to share a little bit more about those.
So once I knew our employees were secure, and as I mentioned, you have to make sure that foundation is solid. The next thing I did, literally starting the week of the 16th of March, was, okay, how best could we help our dental community? So if you think of our company, it's like 3 legs of the triangle. It's the employers who pay the benefits for their employees, the dental benefits. It's the dentists who deliver the service. And then the third leg of the triangle is the patients or the employees of the employer who go to the dentist. And in the middle, are the employees, myself and our board, trying to make all this, work. So once I knew we were settled internally, the next leg of the triangle that I worked on was the dentist, because they literally went from seeing, let's say, 1,000 patients to 10. So it was both a biological crisis and an economic crisis. And their personal protection equipment, the infection control standards, all heightened. So there was fear, there was lack of the ability to get the personal protection equipment. And candidly, there was an economic issue, because basically they were seeing at best, 10% of their clientele, and in some cases, some offices just completely shut down. So the first thing we did is we did a very simple program of not loans that they had to apply for or anything with strings attached. We basically said, we're going to take a certain percentage of what we paid you in 2019 and just give you a relief check so you could use it any way you want. And that amounted to about $4.3 million. And I can tell you, basically, for many dentists who responded to me, first of all, universally, 100%, everybody was thankful. But beyond that, it was like, this was the money they needed to help with their staff until they got the federal government relief, which a number of them were getting. And so we provided a really good bridge program, not a loan, but literally a gift to keep them alive. And if you think of it from a public policy perspective, this is allowing dentists to help them to stay in business. And so when they are allowed to see the regular patients for regular visits, they'll be operational. So what I say to our employers, we're trying to make sure that there's access, because once it opens up legally, we want to make sure these dental offices are open. So we did that program, simple, easy to administer. And then we did a few other programs. For example, we were encouraging teledentistry, something that we were leading edge on. And so we paid dentists for their teledentistry submissions. So again, another sort of relief payment. We also knew that there was a shortage of masks, surgical masks, PPE, personal protection equipment. And so through a reputable supplier, one of our employer customers, we, at our own cost, bought 100,000 of those, and we're in the process of distributing these masks to the dentists so that they are able, them and their staff are able to see the patients once they're opened up. If I were to take all the data and summarize it, I would say 80% of the population will come back to their dentist in the next 2 or 3 months. 50%, if the dentist called them today and said that they can have an appointment, on May 18th, I would say about 50% of citizens would go back. And then there's a not an insignificant number, maybe 20% that is saying, I'm going to take a wait and see. I'm going to hold, I'm going back to the dentist until there's a vaccine. So that's the data that we're looking at. And why that's important, it's a great question, Rory, is because we have to project, our actuaries have to project, even when we get to a pre-COVID sort of almost claim flow, if we know that there's only going to be 80% of the normal flow going to the dentist, then we would price accordingly. And as you know, because you studied the dental space already, even pre-COVID, 20% of the population, even when the employer is paying for the premium, don't go to the dentist anyway. And so now, maybe that now becomes like 40% of people won't go to the dentist. So we're looking at all those numbers, and that will help us price the business correctly in 2021, and then also obviously plan for staffing.
Yeah, that's been great, Tom. I mean, I could and we probably will pick up offline to talk more, because it's always interesting to talk this through. But I know how hard not only you, your leadership team, and all your employees are working. So I won't take up any more of your time. That's been really helpful.
I appreciate it, and I appreciate also the insights you've given me on COVID-19 and other areas of the dental space. And if I could leave who's ever listening to this one thing, you can't communicate enough. A lot of innovation is going to come out of this as well, in terms of how we do our customer service and other things. But I think we'll get through this stronger as a dental industry, but I think in general. And thanks for your help with this as well.
Yeah, of course. That's been great. So this was the interview with Tom Raffio, the CEO of Northeast Delta Dental. If you go to the Elixirr page on LinkedIn, you'll see some of the other interviews that we've been having with other leaders around the world. And do, of course, reach out to us if you've got some views that you would like to share. All right, Tom, I will bid you good day, and thank you again.
Thank you. All right, and we'll talk Friday.
Will do.
All right,
Cheers.
take care.